Good morning. Today's program is brought to you by the Oklahoma Healthy Aging Initiative, or OHAI as it is more commonly known. We are funded by the Donald W. Reynolds Foundation and operate within the Department of Geriatric Medicine at the University of Oklahoma Health Sciences Center. My name is Keith Klaczynski with the OHAI State Office. OHAI is a statewide organization devoted to the health of older adults. We teach classes for older adults and their caregivers, provide family and professional caregiver training, partner with health systems across the state to provide specialized geriatric care, and work with local leaders to promote the interests of older adults. Today is the first presentation of our 2016 OHAI video conference series. These topics we don't always address with our community programs, but they are topics of interest to you and topics of importance to older adults across the state. Please join me in welcoming our guest of honor, Dr. John Carment, Medical Director of the Northeast Center for Healthy Aging and Assistant Professor of Geriatrics at the University of Oklahoma School of Community Medicine, Tulsa. John Carment, MD, completed medical school at the University of Oklahoma, followed by postgraduate training at the University of Arizona and the University of Texas Southwestern Medical Center. He is board certified in internal medicine and geriatric medicine and is on staff at St. John Medical Center in Tulsa, Oklahoma. As a clinical educator, he devotes his time towards educating future doctors as well as providing care for elders in a broad spectrum of clinical settings. Dr. Carment serves as the medical director for the Tulsa Jewish Health Care Center and is one of the medical directors for Miller Hospice in Tulsa. He is the medical director for the Northeastern region of the Oklahoma Healthy Aging Initiative and has been invited to speak at provider and public education events in Northeast Oklahoma. His professional interests include clinical education in geriatrics and improving the quality of care delivered to elders. Welcome, Dr. John Carment.
Thank you, Keith. It's my pleasure to be here today to speak to you all out there in different cities here in Oklahoma. And today we're going to be speaking about medication management for older adults. Some of my goals today are to be able to empower you all to be more active in your participation in the use of medications, which medications you use, which are safest for older adults, and also give you some tools to use to help you reduce your risk for possible side effects, untoward effects from medicines that you may use. Why is this important? About a third of hospitalizations in those over the age of 75 are actually caused by medication side effects. Some also, these hospitalizations could be caused by failure to take prescribed medications. Taking incorrect dosing of some medications can lead to significant harm and hospitalization. Were you aware that of the people that are hospitalized, 40% of hospitalizations due to medication-related problems are in those age 65 and older, and up to half of the people who die from side effects from medications are also this older population. So they're really the ones that are most sensitive to these kinds of problems. And a significant number, estimated to be anywhere from 50,000 to 75,000 people in the United States each year die due to medication-related problems. If you added all these together, it would be the fifth leading cause of death in the geriatric population. Very concerning, half of all these deaths are considered preventable. If the better medications were chosen, people had been taking their medications in a better manner. And all these events, these hospitalizations, problems, they add up. The estimated cost for inappropriate medications and their consequences over the entire United States is estimated to be about $200 billion a year. These costs come from a lot of different reasons. The medications can cause problems leading to nursing home placement. This can be a significant reason for costs and is estimated to be about $33 billion a year. With the extent of the problem and all of the consequences, some people have called this America's other drug problem. So what are some of the factors responsible for America's other drug problem? Well, one is that older people are much more sensitive to medications. There's a lot of changes in our bodies, different organ systems, our brains, that make one medication that may have worked just fine when you're younger, may have a lot different effect on your body as you get older. Also, as we tend to age, we tend to develop chronic illnesses. And several chronic illnesses together can make your system more sensitive to medications and also certainly play a role with one another in your overall health. Another factor may be that you have multiple different prescribers, multiple different specialists that you're seeing that may be prescribing different medications, and it may be that no one is really looking at all of these together. So multiple prescribers is also a factor in this problem. With the availability of information out there, be the internet or the library, people tend to want to look and try to figure out what's going on themselves, and it makes sense that they would want to try to treat this themselves. This may lead to problems, particularly if you use medicines, and some of these medicines we'll talk about are available over the counter that can cause seniors a lot of problems. As you increase the number of medicines that you take, this is prescription medicines as well as over-the-counter medicines, the risk that you'll have some interaction or some side effect goes up significantly. In fact, if you take more than 10 medicines, it's almost guaranteed that you're going to have some sort of undesirable side effect or interaction amongst those medicines. And one thing that we don't think about as much, but physicians and pharmacists think about a lot, are how the individual drugs can interact with one another. Whether the medicines are metabolized in your liver or your kidneys, they may be using the same pathway for metabolism, and this can lead to increased levels or decreased levels of one of the medicines you're taking. Also, one of the problems that we'll talk about a little more in depth for America's other drug problem are problems with compliance, or what we call adherence. And this is simply a person's ability to take medicine as prescribed on a routine basis. And there's lots of reasons for this. We'll talk a little bit about Medicare Part D as also as a factor in this. So polypharmacy simply means many medications or many drugs. There's not really a specific number, but anytime that you start developing side effects from medicines that you're taking, we would certainly consider that polypharmacy. And the simple fact is that older people disproportionately take more medicines than younger persons. And over 30% of prescriptions are taken by those over the age of 65, even though they only represent currently 13% of the population. And it's estimated that about half of over-the-counter medicines are taken by older individuals. Also, it's very common, again, to develop chronic health problems as you age, and these are appropriately treated with medicines. And as such, over 80% of older people take at least one medicine per day. So the American Geriatric Society has developed a list of medicines that have undesirable consequences, undesirable side effects for older individuals. This list we refer to as the Beers list, after Dr. Beers, who is a pharmacist. And using this list and looking at the medicines that older individuals throughout the United States take, about a quarter of all prescribed medicines that older people are prescribed are found on this list. So they're potentially inappropriate, would be higher risk for side effects. And so it just goes to show that this is certainly a ripe area for improvement. Additionally, and this is fairly interesting, about a third of all medicines, if you look at the reasons why people take them, about a third of medicines are found to be potentially unnecessary. And this may be over-treatment of a problem, it may be treating a side effect of another medicine, that sort of thing, but the more medicines that you have on board, the more likely you are to have problems. So these drug-drug interactions I had spoken about a little bit earlier are really when you have two or more medicines that you're taking that interact with one another or interact with your own body's metabolism, which can increase or decrease levels of one of the medicines you're taking. Of course, the likelihood of having an interaction goes up with the more medicines that you're taking. These side effects that they cause can be more problematic for older individuals, mostly because of what we call a decreased reserve capacity. And to give you just a brief illustration, an older person may be less tolerant to lower blood pressure as they stand or as they're walking around. Taking several blood pressure medicines may cause blood pressure to get too low, and if you're younger, you may have felt dizzy. But as an older person, you don't have as much of that reserve capacity, so it may actually cause you to lose consciousness or to fall. So that would be an example of how an older person would be more sensitive to these drug side effects. It's extremely important as far as reducing your risk for medication adverse effects that your physician and preferably your primary physician would know all of the medicines that you take. This includes not only prescription medicines but non-prescription medicines as well as any herbal medicines or supplemental type remedies that you're taking. There can be significant interaction between prescription medicines and non-prescription medicines, just by having a list of prescribed medicines doesn't tell the complete story. One thing of special mention with a lot of the supplements that older individuals may take, these are not regulated by the FDA, the Food and Drug Administration. In general, it is a buyer beware kind of an environment, and as that meaning that the consumer or the older individual would be responsible for making sure that that particular supplement may not interact with things that they're already taking. There are several that can have significant interactions with prescription medicines, things like blood thinners. As such, where it really is important that you have that complete list down for your doctor or pharmacist to review. So what kind of medicines do older people take? Looking across the board in the United States, the most commonly consumed medicines are medicines that typically used to treat things like heart disease, be it congestive heart failure or coronary artery disease. Blood pressure medicines, it's been estimated that 3/4 of older adults have high blood pressure, and so this is a very common medicine for older people to take. Water pills or diuretics can be used to treat blood pressure or heart problems, also extremely common. There are several classes of blood thinners and several reasons people take these, but they also are a common class of medicines to take. Some blood thinners, particularly the ones that have been around for a longer period of time, like Coumadin or warfarin, really have a pretty significant number of potential interactions with other medicines and need to be paid close attention to. Medicines that decrease blood sugar, those taken for diabetes, are very common amongst older people. Psychoactive medicines, which may be medicines taken for depression or anxiety. Those types of medicines are also commonly used by older people. Other common medicines, of course, things like arthritis get more common with age, and injuries from falls, and so painkillers are commonly prescribed to older individuals. Laxatives are commonly prescribed and are typically over the counter. Cold and allergy medicines are commonly taken by older individuals, and this is a class that probably deserves special mention because it's fairly prevalent, especially this time of the year. In general, the medicines that are non-sedating, the newer allergy medicines, or so-called antihistamines, are probably your safest bet for older individuals. These would include medicines that have been branded as Claritin or Allegra or Zyrtec, and taken alone, those are going to be the safest allergy medicines for older individuals. They can also be combined with a decongestant called pseudoephedrine. The decongestant, which is also found in combination products, is the component that typically could increase blood pressure, could cause problems with particularly a male's ability to empty their bladder. And I generally recommend not taking over-the-counter decongestants for that purpose. The older class of allergy medicines, the sedating antihistamines, things that are branded like Benadryl or Actifed, those medicines can cause significant side effects for older individuals, increased risks for falls, increased confusion, blurred vision, just to name a few, and in general should be avoided. The over-the-counter sleeping aids are fairly commonly used by older individuals. Most of these medicines are actually these sedating antihistamines, so things like Benadryl are typically going to be your active ingredient. So those medicines are fraught with side effects and generally should be avoided. Older individuals also take a number of vitamins and minerals as well. So what kind of problems can be seen with the use of inappropriate medications? And these, again, are medicines that may not have a specific reason or diagnosis that they're being used to treat. They certainly can complicate other health problems, can lead to problems like depression, and to go back to the example of the sedating antihistamine, they can cause a person to feel very groggy, poor quality sleep, which can appear as depression or loss of energy. Also, a lot of these inappropriate medicines can increase risk for falls. And so if falls are the leading cause of injury among older individuals. So that would be something we want to prevent. There's one thing that we call cascading prescription, or cascading polypharmacy, I should say, and that's when an older individual may take a medicine, may experience a side effect, and due to that side effect may take another medicine. And so you can see the numbers of medicines can kind of grow significantly from that point. And just to give you an example, there are several medicines that may cause things like diarrhea. And so if you take the medicine, you develop diarrhea, you may be taking an additional medicine to treat that diarrhea, where it would have been preferable to use a medicine without that side effect in the first place. So speaking a little bit about medication adherence in the elderly, this is the ability to adhere to a prescribed regimen. There's a lot of factors that go into that. We all know, this has been well studied and well documented, that as your medication regimen becomes more complex and requires more time, that your success with following that regimen is going to decrease. And so it's always much more preferable if there's a once-a-day medicine that can do the same amount of good, that be used in place of a 4-time-a-day medicine or 3-time-a-day medicine. And so a general principle with prescribing medication in the elderly, is trying to use the lowest number, trying to keep the cost the most reasonable, and to those are ingredients that will help to increase success. Some of the reasons why we see a non-adherence in the elderly: cost. So if you have, let's say, 3 or 4 chronic health conditions, and each chronic health condition requires 2 medicines, now all of a sudden you have 8 medicines that you're taking. If you lived on a fixed income and only have so much money for things like medicine, you can easily exceed that with the cost of medicines going up as they are. Confusion, and that may be simply kind of memory loss, difficulty kind of following a complicated medical regimen can lead to non-adherence. Oftentimes there may be fear of the medicines, that you'll become addicted or dependent on the medicines, and that may lead to not using them as frequently. That fear oftentimes is unfounded, but should be discussed with your doctor. Sometimes we take medicines for a specific problem and we start to feel better, and so we feel, well, don't need the medicine anymore, where in fact the reason you might be feeling better is because of the medicine. And this is particularly can be seen in medicines that treat things like depression, where mood might be better, you might feel that you no longer need it, and oftentimes because of the lag time of these medicines for the effect that they show, you may be several weeks after stopping it before you realize that you're not feeling better anymore. Taking medicines at the wrong time can lead to problems. I've had numerous patients that I take care of that we find problems with, for example, dosing thyroid medicines, which are very susceptible to taking them along with foods or other supplements. It really changes the absorption, and so by them not being aware of that and taking it with meals, it really negatively affects the benefit the drug is doing for them. If you're not real clear on the dosing parameters and taking too much of the medicine, there are certainly you can get into problems with side effects there as well. So I think one really important take-home point from my message today is to really utilize your physician and your pharmacist to help keep you safe with medication use. I think pharmacists nowadays are oftentimes at a retail pharmacy you might not see the same person and you might not feel that connection, but they really can be an ally to keeping you safe from medications. The important questions that you should be asking of your doctor and your pharmacist: one, what is the name of the medication? And I think it's wise to know not only the brand name but the generic name, because those two things can be used interchangeably. And very importantly, what is this medicine being prescribed for? So going back to that 30% of medicines may be unnecessary. If you know exactly what the medicine is being prescribed for, you'll realize that this is necessary or not. How the medicine is to be taken, if it's to be taken with food or on an empty stomach, what time of the day is it best taken. Sometimes there's a lot of variation in this. Sometimes it's not as important, sometimes it's very important. Those are things that you should know for each of your medicines. And how long are you to be taking it? Is this medicine that's going to be something potentially short-term, or is this more of a long-term, indefinite kind of medicine? I think it's important to know the common side effects. That way, if you experience these, you'll know, why they came about. I would use some caution in reading every single side effect, because sometimes that can cause too much fear and not wanting to use the medicine, and then you would not be actually getting the benefit of the medicine for fear of a side effect that may be experienced by 1 or 2% of the people that take it. But do be knowledgeable about the common side effects. How much does a medicine cost? And this is a tricky question because how much a medicine costs it really depends on the individual person, their insurance coverage, whether or not they've met their deductibles. There's a whole lot of different things there. But you need to know, is this something that is feasible for me? Is it something that I can sustain throughout the year? We still live in a time of the donut hole if you're on a Medicare Part D program. And we know that if you're taking expensive medicines, they may be well covered for the first part of the year, but eventually you're going to get into the donut hole and you'll have to pay nearly 100% of that medicine, and that will cause you some problems further down in the year. So planning up front can sometimes help to reduce your risk for that. And always ask if there's a generic equivalent available, as this is something that typically will be covered a lot better and be lower cost for you. So these are some strategies for trying to improve the safety of medication use. So if you can, it's always best to use a single prescriber. And the way my patients do this are, they will come to me and say, my urologist recommended I take this medicine, but I would like for you to fill that medicine. The advantage of that is I have the master list of medicines. I know what that person's taking. I know if there's interaction with other medicines, and we can kind of keep tabs on all of that. Using a single pharmacist and really getting to know your pharmacist there. And again, this is a double check system where the pharmacist can also look and say, are there interactions between the medicines that you're taking? It can be a very, very good resource there. If you're taking a new prescription, the pharmacist still offer a consultation for that medicine, and they will go over things like the common side effects, and also look through to make sure there's no problems with your other medicines you take. That's a service that I'd recommend that you do, especially for a new medicine. It's always a good idea to check your medicine that you were dispensed before leaving the pharmacy. It's not common, but there have been times when people are given a medicine that is not correct or an incorrect dose, and it's something that can be remedied pretty easily before you leave the pharmacy. If it's different appearance than what you're used to, it's also a fair game to ask your pharmacist, is this the same medicine but a different pill? They'll be happy to explain that to you. I've even had a few patients that have difficulty swallowing larger pills, and by looking at the medicine in the bottle, they're able to say, this pill looks too big for me, and talk to the pharmacist, because oftentimes they can exchange it for maybe a different sized pill of the same medicine. Always try to stick with using the bottle that's labeled with the medicine. Sometimes you can be tempted into kind of combining things, but if you do that, there can increase your risk for problems of not knowing which medicine is in that bottle, or if this is an old batch or new batch, or so on and so forth. I really encourage older individuals taking more than 1 or 2 pills a day to use a medication organizer. These are very inexpensive little plastic boxes that have days of the week and time, different time slots. But by using that and by filling it every week, you're going to be a lot more successful at taking the right medicine at the right time and really get the most benefit from your medicines. And so it's just a very good strategy to do that. If you're having difficulty with memory or something like that, it's also a good way to take your medicines, because then you could have a child or a caregiver kind of give a check and make sure that you're on the right track with the doses and the time of the doses. It's also a good idea, I think, to use a calendar, particularly for medicines that may be taken infrequently. There are several medicines that are prescribed now that may be taken on a weekly or a monthly basis, and it's going to be very difficult for you to remember those unless you have them written down somewhere accessible that can remind you. And so using a calendar is a good approach to doing that. I think it's different people can come up with different systems, but it's very important to have a system and not just haphazardly take the medicines from the individual bottles and think that you'll remember those every day at the right time. It's always a good idea to have an annual, we call a brown bag medication review. That's when you bring your medicines in a bag. Doesn't have to be a brown bag, but can be any container. Try to bring in all your prescription medicines, your over-the-counter medicines, and any kind of supplements or herbal medicines you're taking, and allow your doctor to look at those all together. It can be very helpful, and many times I've found problems and been able to change things for the patient, but I wouldn't have known that had I not seen it with my own eyes. So that's always a good idea, and to do that at least annually. It's also very important that you keep an updated list of your medicines with you at all times. In the event that you were hospitalized, or if you're traveling and needed to seek care, we're not advanced enough yet to where everybody knows what medicines you're taking based on some kind of electronic health record. If you are acutely sick, you really need to have that information with you. And so I think it's best. It can be a handwritten card. It can be a typed kind of computerized little card, but make sure it's something that you can update and that you can keep with you. And to give you an illustration, this is one that's available through a government website that you can actually, the address is down below, but you can use this template to create your own list. And you can see that this list has things like the medication name, the reason for taking the medicine, the instructions, and then you can even use some of these pictures to remind you, what time of the day to take it, how many pills at what time. And it has a date created field on it, which is very important to know that this is updated information. Really contains the most up-to-date prescriptions. So, and there's lots of other resources like this, but I really encourage you all to use something like this for your medicines. So one of the last things to talk about is what to do if your medicine that their doctor prescribes is not covered by your insurance. So there are several potential solutions to this common problem. One, have your doctor change to a medicine that is covered. This seems easy enough. Oftentimes one of the problems is the doctor having access to your formulary, which is the list of all the medicines that are covered, things you can do to facilitate that are talking to either your pharmacist or your drug plan about asking if there's alternatives or substitutes that might be the same class, and if you brought that information in, that would be enough to have to give to your doctor, I think, for them to make a good decision if that was a good choice for you. If there really are no substitutes available, there are regulations in place that allow you to ask for an exception to their rule. This requires more documentation from your doctor on why the alternatives are not acceptable, or that you may have already tried them all and had poor results. But submitting an exception oftentimes can be successful in getting like a year-long coverage of a medicine. It's also part of the Medicare regulations that they give you notice if they change their formulary, which affects your drug coverage. And so typically this would result in you getting a letter in the mail saying that they're providing you with so many pills, but that this medicine is no longer covered and that you need to talk to your doctor about a substitute medicine. Don't assume that your physician, gets this information. I think it's best to be proactive about this and call their office and let them know and really try to see what alternatives are available. And with so many Part D plans out there, each Part D plan makes their own deals with the different pharmacy benefit managers and medication suppliers, that they truly do offer different coverage for different medicines. So what you should be doing every year, and this is typically done like in the November, December timeframe, is get a list of your medicines and go through and look at the plans and see which ones line up best with your needs. Because it may be that you are going to do best by changing plans at the first of the year. This is something that you're only allowed to do once, but really may make the most sense overall. So some of the reasons for developing a self-medication management, and that's really what we've talked about today, are ways that you're more informed about side effects, that you have a system in place to take care of your medicines, that you're proactive about maybe substitutions that might be necessary, or that this will decrease your chance of developing side effects. That, depending on the severity of the side effect, will decrease your risk for hospitalization and consequently death. If you're able to reduce unnecessary medicines and reduce side effects, then you will be also reducing your costs for medicine and overall healthcare costs. And those are all good things. So some of the conclusions, the takeaway for today: medication side effects or adverse effects do disproportionately affect elders. Older individuals consume more medications than younger adults, and also are more sensitive to the side effects that medicines have. That you should really know the reason for each medicine that you take, and that you should make sure that your primary care physician has the master list, an updated master list of all of your medicines, and that you carry this with you at all times. And really, those are some of the best tips to keep you safe from medicine side effects. So, and this concludes my presentation. I really appreciate your attention out there, and hopefully you came away with some good information. Thank you.
Thank you, Dr. Carment.
Yep.
Thank you again for joining us today. Please help us bring more programs to you that address your interests by completing and submitting the survey on this video conference to your librarian. Also, please be sure to note any technical difficulties we have experienced. This is the first of a series, so it is a work in progress, and we would love to get your feedback on what would make it more user-friendly. To view today's broadcasts again, in a few weeks, type OHAI, OHAI, in the search bar on the YouTube website. You can also learn more about OHAI's lifestyle and wellness programs and classes that were mentioned in our opening by going online to www.ohai.org. Let's get healthier today together. Thank you.